And so as I'm positioning even the neck, I'm thinking about the whole pattern unwinding and where's the position where there's the most ease. And that's where we adjust. Because we also have the hardware in the spine, there is also scar tissue there. So we're just checking the spine, and we're going this counterclockwise pattern on the sacrum, right there. Good. Yes, I'm gonna adjust the talus, and I'm gonna connect it, and you'll see it move right there. So that's where I tensioned up to that point in the abdomen. That's where I send the impulse. You feel that hip release?
So I developed adolescent scoliosis when I was about 14, and I had a 35-degree and a 45-degree angle on my spine. And so the doctors recommended immediate surgery, spinal fusion, that I had in 2001 when I was 15. And I didn't experience any pain up until after I had my surgery. And then throughout the years, it just started progressing and getting worse. And I've been through multitudes of doctors of all different varieties. And I had been recommended to a chiropractor before, so I did talk to 2 separate ones, and both of them were not comfortable with my situation and working on me because of my spinal fusion. And then the Source was recommended to me right before they opened, and luckily they gave me a lot of hope for being able to help my situation. This was literally my last attempt at finding care for myself because I had been through multitudes of doctors. Up until I came here, I was getting epidural injections in my spine of steroids to try and help the pain, which the pain doctor raved about and said all kinds of good things about. But I never had success with it, and the steroids really messed with my system. So it was recommended that I come here and check it out, and I did, but at that point, I had just closed my hair salon because I couldn't stand any longer. My typical schedule was 6 days a week, 12 hours a day, and I wasn't able to do it anymore. I was hardly able to walk without being in excruciating pain. My family had to wait for me when I was walking because I was so slow. Sleeping was nearly impossible, and sitting like in the car for long distances was even worse. So it's like no matter what I did, sit, stand, lay down, there was no relief. And so naturally coming here, I was skeptical, especially being told by other chiropractors that there was nothing they could do. So, but after I spoke with them, they gave me a lot of hope that they could help. And I just allowed myself to go with the flow and see what happens, since it was my last resort. And so far, I can sit in the car for 8 hours. I can walk faster than my family in the grocery store, and sleeping is 90% better, at least, than it was before. So I'm still very hopeful for more progression.
Thank you for watching Taryn's story. And now we're gonna go ahead and get her adjusted. So Taryn, if you wanna go ahead and lay face down for me. And so welcome to the Tensegrity Series. This is where we discover the ideal expression between tension and compression mechanisms within the human body. As you're learning from Taryn's story, I believe it's super important that the world hears this. One, to be self-empowering. The more you understand tension and compression within your own human frame, the better you are able to make moves to help meet your needs. Another piece is, as you heard from her story as well, the need for chiropractors to get this. She went to 2 chiropractors that turned her away because they weren't ready to see this case. And these people need a lot of help. And so I'm so grateful that Tayrn found her way to the Source and that we're able to do what we do. So let's go ahead and begin with our, at least face down assessment. When you come in for an initial assessment at the Source, we do a full functional 45-minute exam. And now Taryn's been with us for a while. So now when she comes in, we have a conversation, she lays down. I'll check the feet. All right, I'm checking for heel tension, which is also can be related to Achilles tension, but not just Achilles tension, it can be a reflection of spinal cord tension. You're also often checking leg length and inequalities, which can mean a variety of different things. One of them being a posterior rotated ilium, but also being a contracted psoas, bringing the whole hip up superior, and other factors. But let's go ahead and check in. So in initial scan of the system, what we feel is that we have some tension going outward in the mid to upper back. There is a curvature. It's a left to right curve here. And so when you look at ribs, they're all going to be pretty posterior. So if you can come over here, Alex. So along the shoulder blade here, we're going to have a lot of posteriority of the ribs as the spine turns this way. And so as I'm working with the system, I wouldn't adjust it further in tension. I'm already at tension here. I got the ribs again and transverse processes of the spine pulling posteriorly. So because I'm already traction this way, I'm not going to continue any adjustment that way when I'm looking at the tension compression mechanism as the whole. So to make this adjustment, I need to compress back towards the midline. And as I compress back towards the midline, what I should feel above, below, and at the level I'm adjusting is greater ease in the spine. And what does ease represent? It represents an easeful tone. Muscles are more relaxed. The fascial system has less distortion. There's a better space in the actual facet joints. And when everything is dialed in, that's when we make our adjustment. So it's right there. Through. Why is it important to find the balance of tension and compression before making an adjustment? Is because when you put that impulse in, that is what the system is learning. So I don't want to adjust a system in distortion. I want to adjust it as close to ease and a resting tone as possible. And so you have to feel, listen, notice, observe before ever delivering impulse. So we just got to release through the sacrum just with this little unwind. And so, you know, the cavitations, the sound that happens from joints, I like to think of them as like pressure release valves. So often you'll release that pressure somewhere in the spine on its own as you're making movement from the areas of higher distress. Okay, so adjustment one. This brought a lot more ease to the mid and upper back. And again, like I said, I have a curvature here to the left. Now the hardware is, I believe, in between T10 and L3. So I have hardware here. And unfortunately, you know, in a lot of schools, they teach that when somebody has surgical hardware, you can't do osseous adjusting. It's not true. You have to be able to listen to where the body is willing to receive that adjustment. And often, yes, you'll adjust above and below, but every now and then there is an opening into the hardware. And I've had people that have surgical hardware have tremendous changes and benefit to their health and to their lives by getting it adjusted when it needed adjusted. All right, so what I'm feeling now is this curvature going to the left. We're creating a compression at the base of the sacrum. So these coming together, we're gonna relieve that because as I unwind this, that spine starts to untorque and unwind with this motion. So it's a counter-clockwise motion on the sacrum. Go ahead and go this side up, Taryn. All right. So yes, it's been beautiful to see Taryn's progress throughout care. And I will say this, we reached a point where we were plateauing with Taryn, and at that time, I think she was coming in, closer to once a week? Once a week, and based on where we needed to go, the frequency was not enough. And so we went actually to 4 times a week, twice a day for a little bit, just to break through that plateau. Now, you know, wherever you're at out there, you know, this is up for you to decide, but because she was already in care and I wanted to increase frequency, we took care of the extra visits because I'm about getting her results as a primary. Now, with that said, that higher frequency can really allow you to break pattern when you have some real strong myofascial patterns that are having a hard time break through. Because we also have the hardware in the spine, there is also scar tissue there. So we're just checking the spine, and we're going in this counterclockwise pattern on the sacrum, right there. Good. Go to the other side. And so I can, you know, when I first started adjusting Tayrn, I was gentle. And we've kind of progressed in intensity as we've gone up. But you have to check, the response of the hardware to the actual impulse. And so I did feel like it caught a little bit at the bottom of the hardware. And so now I'm going to check the lower lumbar L4 in rotation. We're going to bring over. And I'm also paying attention to the L1, L2, T12, right there. I got you. There you go. Face up. Putting in some impulses today. How you doing? All right. So sometimes I'll notice large cavitations and sometimes a little smaller. You're working more of the tissue structures as the impulse comes through. All right. So Taryn had a salon in Tucson, but then she also does some apothecary creation. What's the name of that company, Taryn?
It's under my Wanderlust Gypsy.
Wanderlust Gypsy. She made some salves for us here at the office that we absolutely love. So C6 on C7. So the whole time we're adjusting Tayrn, we're aware of the entirety of the pattern, right? The left lumbar curve to the right thoracic curve, the posterior rotation on the T4, T5, thoracic and rib heads. And so as I'm positioning even the neck, I'm thinking about the whole pattern unwinding and where's the position where there's the most ease. And that's where we adjust. So in the principles of tensegrity, there's no local phenomenon that does not affect the whole. That's the principle. That when you change one thing in a whole system, that the entirety of that system needs to move. So we're not dealing just with individual subluxations or whatever you want to call them, fixations of the spine. We're talking about global patterns and helping the entire global pattern unwind. So from here, this is connected all the way up the leg. So I have a compression here at the talus, basically ankle joint. And then that carries through the shin, up the femur, and then it actually anchors right there in the lower abdomen. So yes, I'm going to adjust the talus, and I'm going to connect it, and you'll see it move right there. So that's where I tensioned up to that point in the abdomen. That's where I send the impulse. You feel that hip release? See, actually, that was the biggest adjustment I ever got on the hip, was right here in this video. I felt the charge of that go up the system. Again, the adjustments I'm delivering right now have a higher level of intensity. Just starting out with somebody like Tayrn, super gentle, using an activator, drop table, using the pelvic wedge pieces, those types of things, and then little impulses. But then as you gain familiarity, you gain relationship with the system, you see what it's capable of handling. And so I would say that we were up on the spectrum of things. Okay, you're all set, come on up.
Thank you.
You're welcome. All right, so thank you everybody for tuning in to another tensegrity video here at the Source Chiropractic. Any last words, Taryn?
No, thank you.
You're welcome. All right, and we'll see you next time. Peace.